Hello everyone and welcome to our module on teratogens. Teratogens are substances that cause abnormal fetal development. So if a mother is exposed to a teratogen when she is pregnant, potentially there can be harm to the baby. Some of the things that can happen are, first of all, there can be fetal loss, there can be growth restriction of the baby, a number of birth defects are associated with specific teratogens, and then there can be long-term consequences to the baby like impaired neurologic function. In general, for most teratogens, the greatest risk is if the fetus is exposed in the first trimester. This is the embryonic period when the organs are forming, and this is when the most damage can occur. So there are different potential consequences to the fetus depending on the timing of when the teratogen exposure occurs. When a fetus is exposed in the first 2 weeks after fertilization, this is called the all or none period. In general, teratogens in this period either cause a spontaneous abortion or they cause no effect at all. After that, the fetus enters the embryonic period where organs are developing. This period lasts until 8 weeks after conception, which is 10 weeks from the last menstrual period. So because organogenesis is occurring in this period, this is when structural defects can occur, where there can be disruption of formation of organs from a teratogen. Beyond 8 weeks from conception, which again is 10 weeks from the last menstrual period, at this point the organs are generally all formed. So what you often see when there's teratogen exposure in this period is decreased growth of the baby. There can be central nervous system dysfunction, but usually there are no birth defects or abnormally formed organs or structures. Lots of different substances can serve as teratogens. We'll start in this video by going through some drugs that are teratogenic, but we'll also talk about substances of abuse, radiation, and chemicals. Let's talk briefly about how drugs are tested for safety during pregnancy. Often this comes from data on animals. The FDA requires that all drugs be tested in animal models. Often the model that's used is rodents or rats. So it's helpful if a drug is shown to be safe during pregnancy in animals, but that doesn't always translate into safety in humans. The other way we establish the danger of drugs during pregnancy is through case reports. So if a drug is used and there are adverse effects in pregnant women, that will generate case reports, and that will modify our opinion of the safety of drugs. But the key point here is that we generally don't test drugs in pregnant women, so we only have data from animal models and case reports to determine whether drugs are safe or not during pregnancy. So based on the available data for a given drug, the FDA places drugs into categories describing their safety in pregnancy. Category A is the ideal category. Drugs in this category carry no risk to the fetus in human studies. But as I said in the last slide, there are very few drugs in this class because we usually don't test drugs among pregnant mothers. Category B drugs are drugs that have shown no risk to the fetus in other studies, for example, in animal studies. Category C drugs means risk cannot be ruled out. There are lots of drugs that are pregnancy category C. Category D means there is evidence from case reports or animal data that suggests evidence of risk to the fetus if this drug is used in pregnancy. And then lastly, category X drugs are absolutely contraindicated in pregnancy. These drugs are known to be teratogenic in either animals or humans. And for all the approved indications of the drug, the risks clearly outweigh the benefits in terms of using these drugs during pregnancy. Let's start by talking about ACE inhibitors and angiotensin receptor blockers. Drugs in these classes are pregnancy class D. If they're used in the first trimester, they've been associated with lots of different congenital malformations. The bigger problem with these drugs, though, is in the second or third trimester where they cause oligohydramnios. These drugs interfere with fetal kidney function and they can lead to fetal renal failure, and that can cause oligohydramnios. They can potentially even cause the Potter syndrome, which is pulmonary hypoplasia and limb and skeletal deformities, and all of these things in the baby are a consequence of severe oligohydramnios. There are a number of classes of antibiotics that are not used in pregnancy because of adverse effects for the fetus. First are the aminoglycosides. These drugs have been reported to cause permanent deafness in babies when mothers take aminoglycosides during pregnancy. Tetracycline accumulates in the fetal teeth and the long bones. It can permanently discolor the fetal teeth, and so it's not used. And fluoroquinolones are famous for causing fetal cartilage damage. They're not used in pregnancy because they can be associated with tendon rupture and other problems related to cartilage damage. Trimethoprim is an antibiotic that disrupts folate metabolism in bacteria, but it can also disrupt folate metabolism in the fetus. And this is bad because abnormal folate metabolism is associated with neural tube defects. And then sulfonamides can displace bilirubin from albumin, so this can raise the fetal albumin level and potentially cause kernicterus. So because of the problems with both of these antibiotics, the drug TMP-SMX, which is trimethoprim and a sulfonamide, is usually not used in pregnancy. Let's talk about anti-epileptic drugs, or AEDs. So women who have epilepsy may require drugs during pregnancy, but unfortunately, all anti-seizure drugs can potentially affect the fetus. Some of the most common teratogenic effects of anti-epileptic drugs are neural tube defects, but these drugs can also cause things like congenital heart disease and cleft palate or short fingers or abnormal facial features. And most of the anti-epileptic drugs used in clinical practice are pregnancy class D. Some of the highest risk anti-epileptic drugs during pregnancy are shown in this slide. Valproic acid is famous for its association with a very high risk of neural tube defects, so in general this drug is avoided in pregnancy. There's also a high risk of teratogenic effects from phenytoin, phenobarbital, and carbamazepine. Now, one thing to know is that many anti-seizure drugs are associated with reduced folic acid levels, and reduced folic acid levels lead to neural tube defects. So if a mother has to take an anti-epileptic drug during pregnancy, usually she is advised to take high-dose folic acid supplementation. So the normal recommendation is for pregnant women to take 400 micrograms per day of folic acid, but in high-risk mothers who are taking anti-epileptic drugs, they take 4 milligrams a day, a much higher dose, to reduce the risk of neural tube defects. It's very unlikely you'll see this in the modern era, but decades ago, when women took phenytoin during pregnancy, their babies could be born with the fetal hydantoin syndrome. In these pregnancies, there was growth deficiency, and when the baby was born, it often had abnormal facial features. These were things like a broad, short nose and wide-spaced eyes and malformed ears, and classically a cleft lip and a cleft palate. And these were all the result of taking phenytoin during pregnancy. Let's talk about caffeine, which is found in coffee. This crosses the placenta and it can increase wakefulness in the baby. There are very few well-conducted studies on fetal effects, but of the studies that there are, most show that the typical levels of caffeine consumption, which is up to 300 milligrams per day, show no evidence of harm to the baby. There are, however, a few studies showing very high intake being associated with spontaneous abortion, so most obstetricians tell pregnant women that it's okay to have a cup of coffee every day, but that they should avoid a very high intake since that could cause adverse events. Diethylstilbestrol is a non-steroidal estrogen, which means it's a drug with estrogen effects, but it doesn't have a steroid structure. And many decades ago it was used to prevent miscarriages and premature birth, but it was removed from the market in 1971. There were a couple of reasons for this. First of all, there was a slightly increased risk of breast cancer in mothers who took diethylstilbestrol when they were pregnant. But the other problem was that female babies born to mothers who took diethylstilbestrol were born with reproductive tract abnormalities, and that's why this drug was taken off the market. Some of the problems seen in these babies included an underdeveloped uterus or cervix, and for these reasons, these babies often grew up to have high rates of infertility later in life. They also sometimes developed growths on the vagina called vaginal adenosis. These appeared as small red spots, and some of them developed clear cell adenocarcinoma, a rare form of vaginal cancer. So this drug has been off the market since 1971, but you will see older women who were exposed in utero before 1971, and they can have ongoing issues with some of these problems listed on the screen here. Methotrexate is a drug that inhibits folate metabolism. You can see that it has a structure very similar to folate, and it disrupts folate metabolism, especially in white blood cells. It can be used as an anti-inflammatory drug. It's also used in chemotherapy. And methotrexate is pregnancy class X. It's never used in women who are pregnant. In fact, I talk about in other videos about how it's used to induce abortion in women with ectopic pregnancies. That just shows you how powerful its effects are on the developing fetus. You should also know that because it disrupts folate metabolism, it can cause neural tube defects, just like anti-epileptic drugs. And besides neural tube defects and fetal demise, it's associated with lots of other anomalies if it's taken during pregnancy. These are things like microcephaly, growth restriction, and limb and cranial malformations. Lithium is a mood stabilizer. It's often used to treat mania and bipolar disorder, and it's pregnancy class D because of teratogenic effects that primarily involve the heart. Among the potential teratogenic effects on the heart, Epstein's anomaly is most common. Epstein's anomaly is when the tricuspid valve, shown here, is displaced toward the apex of the right ventricle so that it's down within the right ventricle. This leads to right heart failure and tricuspid regurgitation. Next, let's talk about methimazole, which is a drug that can be used to treat hyperthyroidism in pregnancy. Rarely women develop Graves' disease or other forms of hyperthyroidism when they are pregnant, and when that happens, they need to be treated with drugs to bring down the thyroid hormone level. And one of the major drugs that's used is methimazole. It is pregnancy class D, and it can cause fetal or neonatal hypothyroidism. And so when you're treating women with this drug, you have to be very careful to try and treat the hyperthyroidism, but not treat it so aggressively that you cause problems in the fetus. Besides problems with fetal and neonatal hypothyroidism, this drug is famous for causing aplasia cutis, which refers to absence of the epidermal layer on the scalp. Usually it leads to a solitary defect on the scalp in about 70% of cases, and because of this defect, the baby will be born with a missing patch of skin or hair. And this is a picture of what it can look like on the scalp shown here. Because of the danger to the developing fetus in the first trimester, usually an alternative drug is used called propethyluracil. This works similar to methimazole, but it's generally less effective. However, it has fewer associated adverse effects in clinical studies. So women with pregnancy-associated hyperthyroidism will usually receive PTU if they're in the first trimester, and then in the second and third trimesters they will receive methimazole. Statin drugs used in the treatment of hyperlipidemia are pregnancy category X. Women taking these drugs should be advised to stop them prior to becoming pregnant. Animal studies have shown adverse fetal outcomes, mostly problems in the central nervous system and also limb defects. The human data is very limited, but much of it shows no major adverse effects. However, because of the conflicting data of harm in animal studies and limited but safe data in human studies, the recommendation is to avoid statins during pregnancy. You should know, however, women who are inadvertently exposed, for example, if they're taking the drug and then find out they're pregnant, probably there's a relatively low risk to the fetus. Thalidomide is another drug that's pregnancy class X. In the modern era, it's used as a treatment of multiple myeloma, but in the 1950s, it was widely used as a sedative in women who were pregnant, and this led to a large number of babies born with limb deformities. These babies were named the children of thalidomide, and if you listen carefully in the Billy Joel song, We Didn't Start the Fire, you'll hear him sing about this. Some of the limb defects that can occur are amelia, which is absence of limbs, or micromelia, which is short limbs, or phocomelia, which are abnormal limbs. And this is a picture of a baby born after exposure to thalidomide in utero. Isotretinoin is a derivative of vitamin A that can be used to treat acne, and it is also pregnancy class X. When women take this during pregnancy, it leads to spontaneous abortions in about 20% of cases. And among live births to women who took this drug during pregnancy, 20 to 30% of the babies develop an embryopathy associated with this drug. Some of the features are abnormal facial features like low ears and wide-spaced eyes. There's also a very high rate of congenital heart disease and hydrocephalus. So a lot of women who are in their childbearing years take this drug for treatment of acne, and for that reason, birth control is mandatory in women who take isotretinoin. The usual recommendation is 2 forms of birth control. If you take massive doses of vitamin A, this can be teratogenic in the first trimester. It's associated with spontaneous abortions, microcephaly, and also cardiac anomalies. In order for this to happen, you have to consume doses that are several times the recommended daily allowance of vitamin A. And this is very difficult to do from a regular diet, but it can occur in women who take excessive supplements during the first trimester of pregnancy. I'll finish with one slide on warfarin, which is an anticoagulant. It is pregnancy class D. It can cause fetal hemorrhage and spontaneous abortion. There are also reports of babies being born with optic atrophy after exposure to warfarin. This leads to vision loss. And then there is a clinical syndrome associated with exposure to warfarin in utero called warfarin embryopathy. This basically involves a number of bone and cartilage abnormalities associated with the mother taking warfarin. One of the classic findings of warfarin embryopathy in a baby is the presence of stippled epiphyses. This refers to small round densities at the end of the long bones on X-ray. This is a picture of what they look like in this X-ray on the screen here. You can also see other abnormalities of bone and cartilage, things like nasal hypoplasia and limb hypoplasia. And so because of the risks associated with warfarin during pregnancy, usually when women need anticoagulation in pregnancy, what's used is low molecular weight heparin as an injection. Okay, moving on from drugs, let's talk about substances of abuse, and we'll start with alcohol. So alcohol is a potent neurotoxin to the fetus, and mothers who consume alcohol during pregnancy can potentially have babies with fetal alcohol spectrum disorder. So fetal alcohol spectrum disorder is a group of alcohol-related developmental disorders that all stem from consumption of alcohol during pregnancy. The most important one, and the one we'll talk about in this video, is fetal alcohol syndrome, but you should be aware that there are a number of other developmental disorders that are all related to alcohol consumption in pregnancy. There are 2 major elements to the clinical features of fetal alcohol syndrome. The first is a group of characteristic facial features, and the second element is intellectual impairment. The characteristic facial features are all shown in this slide here. The first one is a smooth philtrum. The philtrum is the groove from the base of the nose to the upper lip, and it's very smooth in babies exposed to alcohol in utero who have the fetal alcohol syndrome. Some other features are short palpebral fissures. The palpebral fissures are the openings of the eyes. They are very small in babies with fetal alcohol syndrome. And then finally, these children have a thin vermilion border. The vermilion border is the upper lip. And so these facial features, plus cognitive memory and behavioral problems, make up the fetal alcohol syndrome. The diagnostic criteria for fetal alcohol syndrome require at least two characteristic facial features, like those we discussed in the last slide. In addition, there has to be evidence of brain involvement. Some of the things that qualify for evidence of brain involvement are a small cranial size at birth, structural brain abnormalities like microcephaly or cerebellar hypoplasia, or neurologic signs like impaired motor skills or hearing loss or an abnormal gait. And then the final diagnostic criteria is that there must be evidence of growth restriction, so the baby needs to have a low birth weight or decelerating weight gain over time after birth. Alcohol can also lead to a number of congenital heart defects. It's been associated with higher rates of atrial and ventricular septal defects and also tetralogy of Fallot. As I mentioned before, intellectual impairment is a major issue in babies exposed to alcohol in utero. In particular, they can develop a number of neurobehavioral problems. They can have reduced IQ, developmental delay, intellectual disability, and behavioral abnormalities and problems are a major issue. Next, let's talk about smoking during pregnancy. So cigarette smoke has two toxins. One is nicotine and the other is carbon monoxide. And both of these toxins impair the oxygen delivery to the fetus. Nicotine causes vasoconstriction and this decreases the placental blood flow. And carbon monoxide competes with oxygen for binding to hemoglobin, so this decreases the amount of oxyhemoglobin. So when there's less oxygen and less blood flow, this leads to small babies. So intrauterine growth restriction and low birth weight are common in babies born to mothers who smoke. In fact, some studies have found that 20% of cases of IUGR are associated with maternal smoking. The other thing that happens when the mother smokes is the placenta becomes unhealthy. So things like placental abruption and placenta previa are more likely in mothers who smoke. The membranes can rupture early and women can enter preterm labor when they're smoking. And then lastly, there's a very well documented association of maternal smoking and sudden infant death syndrome. Cocaine and amphetamines are stimulants, so when they're used during pregnancy, they cause vasoconstriction. And so just like with smoking, this leads to IUGR and low birth weight babies. It's also associated with placental abruption, preterm birth, and miscarriage. And all of this stems from vasoconstriction and decreased blood flow to the placenta. Marijuana use during pregnancy is discouraged. There is the potential for neurodevelopmental effects on the fetus. In reality, the data regarding safety and risks is limited, but nevertheless, there's enough data that the recommendation is to discourage use during pregnancy. Let's talk about mercury exposure in pregnancy. So methylmercury is found in fish and seafood, and it's not removed by the cooking process. Now, mothers who are exposed to high levels of methylmercury in pregnancy are not usually affected, but the fetal brain is very sensitive to mercury. So if women consume lots of fish and seafood in pregnancy, and their baby is exposed to lots of methylmercury, their child can later go on to develop delayed milestones, and rarely more serious things can happen like blindness or deafness or cerebral palsy. So in general, women are told to avoid fish and seafood during pregnancy. The one exception is that canned tuna is safe, and that's because mercury levels are tested in canned tuna to make sure they are low. And I'll finish with one slide on radiation exposure during pregnancy. So women can be exposed to radiation if they have x-rays taken or have CT scanning done when they're pregnant. No evidence of harm has ever been shown in clinical studies at small dosages, but there is probably some threshold above which the fetus can be harmed, and no one's ever definitively determined what that threshold is. Based on studies from accidental exposures to high amounts of radiation, it's believed that high dosages at 8 to 15 weeks can cause problems in the baby like microcephaly or growth restriction or intellectual disability. So because of concerns for these adverse effects, lead shielding is always used to protect the fetus anytime a mother needs to have an X-ray or imaging test. And in general, we try to avoid X-rays and CT scanning and tests associated with radiation in women who are pregnant. And that concludes our module on teratogens.